So this is our launch of the Workplace Wellbeing Guidebook. It is a guidebook for cultivating a culture of collective care. And this is sponsored by the Mid-America ATTC, Addiction Technology Transfer Center. And I want to just give you a quick disclaimer that this is a SAMHSA-funded project, and this presentation today is SAMHSA-funded as well. The information about using that using our resources is there. You can access this guidebook for free, no cost at all, on the Mid-America ATTC website, which I will drop in the chat. And actually, I have a direct link for that guidebook too. But there's the website for the ATTC network. And our particular Mid-America ATTC in particular. So we are the Region 7 ATTC, which means we serve the states of Missouri, Kansas, Iowa, and Nebraska. We are based here in Kansas City. Well, I say here because that's where I am. We are based in Kansas City. The ATTC, the Mid-America ATTC, is a partnership between the UMKC School of Nursing and Health Sciences and the University Health Behavioral Health. In particular, my department, the Center for Trauma-Informed Innovation. And I am Andrea Dalton. I am the director of the Center for Trauma-Informed Innovation and one of the authors of the book that we are sharing out today. So we've done that, but you can keep putting in the chat if you want to, where you're joining from and any particular interest you have in workplace well-being, what brought you here to this webinar today. You can keep putting that in there as we're going along. I thought it would be helpful just to give kind of a brief, what is the ATTC or what are the TTCs? Because sometimes we throw those terms around, but not everyone is familiar with what that means. So the purpose of the Technology Transfer Centers program, which is funded by SAMHSA, the Substance Abuse and Mental Health Services Administration, is to develop and strengthen the specialized behavioral healthcare and primary healthcare workforce that provides substance use disorder and mental health prevention, treatment, and recovery support services. And so really, we try to help people and organizations put more effective research-based, evidence-based practices into substance use and mental health disorder prevention, treatment, and recovery services. And one of the angles that our Mid-America ATTC has chosen to do that is through trauma-informed practices. That has been a foundation of our work in the last 7 years of having that ATTC grant. We were just renewed for another 5 years, again, in partnership with UMKC. And we're really excited about continuing to spread that work. I know we've worked with several of you on this call already, and looking forward to more opportunities that we have coming up in the next 5 years. One of the nice things about being at the start of a new grant year is that we do have some new things coming. So looking forward to firming up some of those plans and getting that information out to you in the coming months. Do let me know if you have questions about the ATTC or the Technology Transfer Centers in general. I do want to pause here and just say technology just refers to anything. Oh, I made my thumb go up. That's funny. I didn't mean to give a thumbs up. The technology part refers to anything that's like a new or emerging practice or ways that we get things done. So technology, a lot of times in this day and age, we often think of like computery kind of technology or AI or that sort of thing. While it might encompass that, we really are thinking of it from a broader perspective of technology being just those ways that we get things done. So again, want to help support organizations and people in putting some of those effective practices in place to do that. Okay. So we are here to launch the Workplace Wellbeing Guidebook. I dropped the link in the chat just a bit ago for the ATTC, and I'll give you the link here in just another slide for the guidebook itself. But what I want to say before I move on to that is that this guidebook was a work in progress for many for a couple of years, and we were really glad to get that done right at the end of September, and putting that out now, particularly for leaders. We've really designed it for organizational leaders, though I think anybody could really benefit from it. I think there are strategies in particular that are really developed, designed for organizational leaders who are looking to create an environment that supports their workforce, that extends that idea of caring, collective care, to not just the people that are served by your organization, but also the people doing the serving. And that's been a really important piece of what we've done with the trauma-informed care implementation that we do through the Center for Trauma-Informed Innovation and through the ATTC. So that idea that the work we do is really hard when we are serving people who are going through really hard things and have had really difficult things. And also, not only is the work difficult, but those of us doing the serving, have also had lives that may have trauma and stress and mental illness and substance use disorder as part of each of our individual stories. And so that just layers on the challenges with maintaining a work environment that really is healthy for everybody. And sometimes we joke in our department that we're working toward world peace, that we think trauma-informed practices, if we all did them, would generate world peace. I still really believe that. And I think we can also do that on a smaller scale. Like, world peace is a lot to ask, right? Especially, I feel like with everything that's just going on in the world at the moment, that feels like a far reach. But we do have influence over those people that we interact with every day in our workplace. So if we start there, we're going to make a ripple effect. It's not just a little drop. Those little drops ripple out, they start to add up, and it really does make a difference in creating a resilient and trauma-informed culture in our broader communities, in our states, in our country, in our world. So this guidebook, I'll kind of show you a few things as we go through it today, but it's both a resource and a reflective journal. We have intentionally designed that with spaces that you can type in or write in if you print it off. We want you to be thoughtful in using it. It doesn't need to be something you race through. In fact, I really encourage you not to race through it. Take your time with it. Really think about, ask more questions of the people around you, ask more questions of yourself as you're working through it, and give it time, give it space. So the guidebook itself, like I said, you can find that on the Mid-America ATTC webpage, and I'm going to put the link directly for the guidebook here in the chat. Though right now, if you go to the Mid-America ATTC website, it is scrolling across on the banner at the top. So you can click the Learn More button and get right to it. You can also access it from that QR code that's on the screen right now. Particularly those who are joining by video later might find that to be an easy way to get to it if you haven't already downloaded it. It's free. Download it, share it. Though I will say, if you're going to share it with other people, please share the link so that people will download their own copy, because that helps us know how, if we know how many copies were downloaded, that's great for our tracking purposes for the grant, and helps us, justify putting more resources out in the world, which I hope you're all as interested in doing as I am. So get that shared with folks. We would love to have as many people as possible access it. That's why we've put it out in the way that we have. All right, so let's get into it. The idea of workplace well-being, I think, is something that a lot of us have maybe competing thoughts sometimes around. It's difficult to always attend to the well-being of our staff, because we are also attending to the well-being of our service users, whoever those people are that are using our services. And I think there's a lot of challenges that arise from that. Especially when we are providers of mental health services ourselves in our organizations. We don't necessarily fill that role for our staff, nor maybe should we always. I think that can get into some kind of gray areas sometimes. However, where we have kind of rested our perspective for this guidebook is that psychological safety and staff well-being are important, not simply to ensure that the organization doesn't crumble under pressure or unexpected changes, but it's important because your staff are human beings. Everybody deserves to have employment that doesn't impair them, that doesn't make them sick, that doesn't drive more disconnection, that doesn't burn them out. And of course, that's a challenge to provide that in a consistent way. So we hope that this guidebook will help with that. We also recognize that stress and trauma, as I've said, it exists in the individual lives of the people that we serve, as well as the staff that are doing the serving. It's also in our communities. It's in the world. It's in the organizations themselves and in our systems. There are lots of things that create more stress and more trauma and re-traumatization for people that actually are embedded within our systems and within our organizations. And those lead to health issues and sometimes even an inability to sustain that idea of collective care. The more burnt out we get, the less we care about other people, including our coworkers, or maybe especially our coworkers in some circumstances. So we want to try to promote healthy interactions, healthy relationships in the workplace. And so workplace well-being is grounded in the neurobiology of stress and trauma, the principles of trauma-informed care, and a deeper understanding of the dimensions of safety. And you can learn more about that in the introduction chapter of the guidebook. I didn't put those up on the screen, but there they are. Got busy talking. So the guidebook is laid out with an introduction and then 7 sections, and followed by a conclusion with just a few additional follow-up questions for consideration. And then the appendix has several resources also. And I'm going to go through each one of these and kind of tell you what's in each one on kind of a high level. So like I said, the introduction includes kind of the why we wrote this. What is this? What are we talking about? Also the theoretical foundations, who the guidebook's for and how to use it. We think that it's helpful to kind of have that framing of the idea that we wrote this for leaders in an organization. Leaders can't be responsible to fix everything for everybody. However, as leaders, we do have a responsibility to lead the way, to build the culture that does care for its workforce. I'm going to talk a little bit later about some ideas around how to use the guidebook that we haven't actually put into the guidebook itself, but kind of a broader scope of how you might consider using this guidebook. So I'll get to that in a little bit. The first section is about grounding in trauma-informed, culturally responsive, and equity-focused rationale. So we encourage you as you're working through that to consider, like, what is your why? Why are you engaging with this guidebook? Why are you engaging with this work? Why do you care? And I think that you probably do care because you're here right now. So I know that's it's caught your interest. That might be your why, but we also want you to think a little more deeply about why does this matter to you? What do you want to see as the outcomes to the work that you might do, or the things that you might change as a result of working through this guidebook? There's also some suggestions around assessing your organization just for the well-being status that currently exists, and things that have gone on historically in your organization. So when I talked just a moment ago about organizational stressors and organizational trauma, taking some time to really think about, what is impacting our staff and how can we kind of pull back the layers a little bit, because sometimes those things get hidden over time. And just taking a moment to attend to those can be really informative for moving forward. And then also assessing just how your staff are actually doing, what's going on currently. We also encourage you to consider how this work aligns with your own personal values. So much of this guidebook is really about you as the leader, because again, you are the one that's leading the culture. You're leading the shifts toward what's important. So thinking about, again, why it's important to you, why this matters as a person, not just as a leader, but as a person. And then there's also there's a worksheet around the principles of trauma-informed care and how those are currently showing up in your organization and where some opportunities exist for you to deepen those practices. We know that many organizations are already doing lots of things that are trauma-informed, and I think it's important for workplace well-being to really highlight the good things that are happening. Those can often be building blocks or places to start from as you look at shifting into a direction that's going to be even more supportive and caring for those that you serve and those doing the serving. The second section, leaders commit to and demonstrate their own self-care. I'm going to say this several times, probably in the next half an hour, but don't skip this section. Don't skip over it. Don't rush through it. I think the tendency a lot of times for leaders is to say, like, I don't have time. I don't have time to take care of myself. I got to take care of everybody else. I got to take care of all of this other stuff. You making a commitment to your own self-care, aligning that with your personal values, paying attention to your strengths in overdrive, modeling and encouraging rest. All of those things are really important for building a culture of collective care, of workplace well-being. So don't skip over it. It's really, really important section. And we want you to take time to dig into that. Now, one caveat is, and we put this in the introduction, sometimes if you as a leader have not been in a culture that values individual self-care or values collective care within the organization, and you start doing this and you only do this, you might ruffle some feathers. So just know that that's a possibility. And also you might want to plug in a couple of things from the next section too, as you're doing that. So this guidebook isn't designed to be like one thing at a time. You can definitely skip around. You might want to just spend some time kind of, quickly looking through the whole thing and then going back and making a plan for how you're going to implement some things one at a time. Okay, that's all I think I want to say about that. Section 3 is about creating and protecting a culture of well-being. So this is where it starts to get into the broader application to your organization at large. So looking at ways to prioritize things like emotional intelligence and psychological safety, protecting relationships, and then providing support for individual self-care for staff. And a tool that we have introduced in this guidebook, and I know a lot of you have seen this before if you've worked with us or done some trainings like our Compassion Without Fatigue training from the Center for Trauma-Informed Innovation. You've seen the self-care card. So I want to just show you a little glimpse of it here, and you can get this in the guidebook. It's in the appendix of the guidebook. But providing the opportunity for yourself and for your staff to think about, how do I individually prepare for my day? How do I respond to stressful moments that arise, or if I get activated into my stress response, what do I do? How do I pull myself back to a place where I feel grounded and safe and secure? So that middle column is in the moment. And then at the end of the day, how do I release? How do I metabolize that stress response? How do I move that through my body so that I can be okay and I can go home and do what I need to do at home also, without carrying that with me? So encourage you to check that out. There are instructions on that self-care card for how to fill it out and also how to use it as an individual and how to use it in supervision. And we get to that a little bit in the next couple sections as well. Section 4 is about integrating support for collective care within the organization. So we encourage you to think about what's your organizational safety plan. And we gave you some step-by-step questions to think about, pieces of that. We've drawn from a few different resources to create that. One thing I want to say about that, and really all the resources that are in here, is you may need to tweak them for your organization, and that's fine. Do make it work for you. So as you take a look at that, there might be some additional things that you want to add on to your organizational safety plan that we haven't thought of. We'd also love to hear that feedback. So if there are things that you come up with and you're like, hey, it would be really great, I think this is applicable for a lot of people, please send it our way, because we would love to perhaps integrate that into a future revision or be able to share that with people like those who've registered for this today. We also encourage you to think about how you build collective care frameworks for prevention. So what kinds of strategies do you put in place so that people have that sense of psychological safety amongst their coworkers? What kinds of things do you do that build relationships that really lend themselves to your staff knowing what to do when things, go left, when there's a crisis that hits the organization, or when something really bad happens to a client? What do you have some of those preventive things in place, and then also have some crisis response programming in place? A great example that we've talked about in that section comes from some work that we did with Amethyst Place, and I always like to highlight them as especially when we talk about this, because they developed a fantastic framework for that prevention and crisis response programming, especially the crisis response programming. So it looks a little different in every organization. Amethyst Place, if you aren't familiar with them, they're in Kansas City. They provide residential care for moms with substance use disorder that are in recovery, that have kids that they all come and live together. It's a fantastic program. They have worked really hard to embed some trauma-informed practices into what they're doing, and they're expanding right now, which is really exciting. They're adding on more apartments, and it's a really cool time for them. But one of the things that we helped support them with in the last few years of this grant was developing this framework, this crisis response program. So, thinking through, how are you going to care for each other? Who's going to respond? What's the process? How do you know when you're done? You have to think about that too. When is the crisis over? How do you then reflect back on what happened, how we did? Are there things we need to change for next time? Are there policies or processes that are just not working? Kind of doing that reflection back as well. So you can read more about that in section 4. Here's the organizational safety plan. That's the tool that I mentioned, and you can just see a little snapshot here. I just snipped that out. This is also a good time for me to just point out, when you access this in an electronic way, you hopefully should be able to, in a PDF, just click right into that box and type your answer. You can also print it out and write it in. I am somebody who likes to have a printed copy, so I printed it out, and you do what works for you, right? Okay. Section 5 then is about supervision practices. We want to encourage you to promote restoration and well-being in those practices, and also resist re-traumatization. So we've talked just a little bit about what that means. What is traumatization and re-traumatization? How does that show up in the workplace? And then how do you protect relationships in supervision? Sometimes those supervisory relationships can get strained because the supervisor is the accountability person. And that can sometimes put challenges in place. So thinking about how do you provide that kind of management structure that's necessary, but also promote promote and protect the relationship in the process. There's also a little bit about using the self-care cards in supervision, actually encouraging your staff to complete that and then referring to it as you're engaging in a one-to-one supervision meeting. So we've put some tips in that self-care card as well as in this section for how to use that. And then thinking about providing formal feedback, whether that's in an annual review kind of a way, or if there's a situation that arises and you need to provide some corrective action. So there are some tips around that. Also thinking about promoting staff strengths and supporting boundaries in your staff. I think one of the things that often happens in what do we call this? Like in a social service or in a a patient-centered, client-centered environment, is that sometimes we have staff that will do everything possible for their clients, which isn't in and of itself a bad thing, but it can sometimes lead to burnout and overwork and poor boundaries, which can have some negative outcomes. So while we don't want to, I guess we don't want to over glorify going above and beyond. So we just put some cautions around that. We do, of course, really appreciate when people go above and beyond. But if that's the expectation, are we setting ourselves up for poor health? Not just in our individual staff, but in our organization itself. So there's some thoughts about that, some things to work through, some questions. And we've also provided as a resource, and it's in the appendix, a conversation guide for leaders. Again, this is just a little snapshot of it. I think it's a great tool to just print out and have like on your desk, or you carry a binder around and put it in the back of your binder. There are some just nice reminders. I think an important one, and I intentionally snipped this so that it's on there, but remembering that pep talks can have an unintended negative effect. If our staff comes to us and they're upset about something and we try to cheer them up right away without really hearing them out, that can leave them feeling invalidated and can actually damage our relationships with them. So there's some little tips like that. And then we've also provided in the appendix a trauma-informed performance discussion preparation guide. Just some things, again, to consider as you prepare for those conversations. And I think especially remembering to take time to prepare for those conversations is a really important piece. Set aside time. Set aside as much time to prepare as you do to actually engage in the conversation. Maybe even more time to prepare than you do to engage in the conversation. I think if, in particular, if it's a situation where you do have to do corrective action or something like that, really being sure that you're prepared yourself, not just with what you'll say, but also just internally, how are you, if you're really worked up, emotions are contagious. That's on that previous slide too. Emotions are contagious. If you go into that scenario and you're, even though you think you might look okay on the outside, if you're on the inside really activated, people might pick up on that and maybe even overreact to what it is you're saying just based on your way of being in that time. And then section 6, yes, that's in the guide, this performance discussion preparation guide. It's in the appendix. I have already found it to be helpful. So, section 6 then is about developing and reviewing formal documents with the trauma-informed perspective. We've mostly focused on policy and procedure development, and there's also a guide for that in the appendix to take a look at those policies and procedures either as you're writing them or once they're already in place to do a review on them. I know we all have to review policies on some sort of calendar, and being able to do that through a trauma-informed perspective. We've pulled some questions specifically for each one of the principles of trauma-informed care as ways to guide that review. We also have a little section about job descriptions. We haven't given like specific parameters around that because so many of those things are often dictated by your organization's HR requirements or other things, job specifications based on what the work is, licensures, all of those kinds of things. So we haven't got into a ton of detail on that, but certainly can be available for consultation if those are things you're working on and you'd like a trauma-informed perspective on it. And then also thinking about departmental responsibilities and decision rights. When things are clear, people feel safer. When they know what decisions they can make, and what needs to be escalated, they feel better about their job. They feel more competent. So we want to encourage actually putting on paper. I think so many organizations, it's those are some of those unwritten things. And if we can clarify those and communicate them proactively, we do tend to have better well-being amongst our staff in those situations. Confusion activates our limbic system and pulls us out of our executive functions. And not only does that contribute to more stress, but it actually makes us less effective in our jobs in the first place. So trying to promote more of that clear communication. And there's the policy and procedure review tool, or a little snip of it. That we've kind of organized with some general questions at the beginning. And then if you've already got the policy in place, some questions to think about as you're looking at it. And then the final section is about building capacity for the organization to withstand stressors. So this really starts to get into that idea of organizational resilience. Like, can your organization be okay? Can it ride the waves of the ups and downs of whether that's funding or violence in our community or some sort of loss within the company or within the organization? How are you able to navigate that? So taking time to think about what has already happened. How did you get through those things? And what is potentially coming up? I think a lot of organizations are thinking about that right now, as we probably do every 4 years or so, as when we have a change in federal administration in particular, that can sometimes impact the way our organizations are functioning or how we're funded or, all of those things. So thinking about what might happen, not to freak yourself out, but as a way to prepare. And then considering how you strengthen and center your organization's vision, mission, and values. Do those reflect trauma-informed perspectives in and of themselves? I think a lot of times another thing to consider with those, with centering those values is, are the things that we are actually demonstrating that we value the same things that we're saying we value? Sometimes there's conflict in that. So just taking time as an organization to clarify that. And then how do you manage change? We have given a brief tool in there to think about as you're going through a change process. Do you have all the things you need in order to navigate that change? Do you have strong leadership around it? Do you have resources? Do you have skill development opportunities? Do you have clarity in your communication? Are you including everybody? There are, I think, seven things on that chart. And then I've talked about communication strategies a lot, but again, think that that's just a really important piece of how all of this goes into play, is how do you communicate it? And then also protecting relationships in accountability practices. So what does that really mean? How do you keep people accountable in a way that promotes well-being along the way and is not punitive or shameful? I think a lot of our accountability practices sometimes result in a lot of shame, and that doesn't often promote well-being. And then in the conclusion, we encourage you to think about low-hanging fruit, like what's easy to change. Don't try to change everything. You'll freak yourself out and everybody else. So slow down. What's the easy thing to change first? And then visualize what you'd like to see. Where do you see your organization going? Revisit your why also in that conclusion. And then that's kind of the the meat of what's in the guidebook. Some things that I'll just say really quickly, and then I'll open it up for some questions and comments. But if you think about how to use the guidebook, you can absolutely just use it on your own. You can do some individual reflection and planning. You can put a lot of those things into place yourself. Even if your whole organization is not on board with making a lot of changes, there are things that you can do within your realm of influence, your sphere of influence, that will make a difference. And you might not be able to change your entire organization, but you might be able to really impact the culture of your team. And that's a great place to start. You could also think about using this guidebook like with a group of leaders in your own organization. Pull some folks together that are interested in this too. Work through it together. Think about what are some practices you might be able to all do. How can you convey more of that information to your staff? Another way to possibly use the guidebook is to get together with a group of leaders from other organizations, different organizations. Do you have some pals that are in similar kinds of settings that you'd like to also, connect with, get some support around? There's a lot of benefit to that peer coaching kind of concept, being able to bounce ideas off each other, get some support, get some feedback. Sometimes having a perspective from somebody who does not work right alongside you all the time can be really valuable. I'm sure there are other ways to use the guidebook too. Those are the three I thought of for today. Just a few key points. This is not a linear checklist. I mentioned that before. So slow down. Don't have to do it all in order. Get input from people at all levels of your organization. Again, you could do that in formal ways or more informal ways. Might just be checking in. Kind of depends on how on board your whole organization is in putting these things into practice. And like I said before, resist the urge to skip over section 2 or to rush through it. Take time to actually consider how you care for yourself. You will be able to speak with a lot more authenticity about self-care if you're doing it yourself. I almost feel like I'm talking to myself in that moment. So I'm going to also look at section 2 and think about that. Okay, so again, there's the link and the QR code to get to the Mid-America ATTC website and the guidebook. And I'll open it up for questions. You can type in the chat or you can raise your hand, or you can just, there's not that many people here, you can unmute and share. Before we do that, I'm just going to mention that the next steps are download the guidebook if you don't already have it. Make a plan to use it. You can also request technical assistance from the ATTC, especially if you're working in an organization that supports people with SUD or in recovery. There is a link on the Mid-America ATTC website that'll take you to more information about how to apply for technical assistance. You can also just contact me or my team at the center. We can help you with that process. Or if you're in an organization that does not serve people with SUD or in recovery, you can also contract with us through the center in a separate way to get some support around that. Okay, so what questions do you have? What comments do you have? Thanks for clapping, Chad. Okay, if no questions. Oh, Jenny, go ahead and unmute and.
Can you hear me?
Yeah.
Okay. I'm just wondering, as far as I haven't looked at the handbook yet, so this may be something that is evident as soon as I get into it. But given the fact that it was funded by SAMHSA and it was written through the work of this organization, is it really geared towards like behavioral health, substance abuse, or substance use disorder practitioners, or is it more general than that?
I believe it's more general than that. Though I will also say that those of us who wrote, so I didn't actually say before, the authors of the guidebook are myself, Roxanne Pendleton, who's on the call, and Cretia Williams, also on my team, who's not here today. She's off doing another training. Um, and the three of us all have experience working in mental health care and substance use disorder. So, um, our bias in that may come out. Though at the same time, we've also worked with a lot of organizations that are doing all kinds of different work. And so I think we've tried as much as we can to make it more general. But like anything, there's inherent bias in the way that we write and share information. So that could be a factor. But that's a great question. I'll be curious to know what your feedback is on it. Really, anybody, not just Jenny. I'd love to hear from any of you about that. Kim.
This is Kim. Hey, hi. So I work at University Health, Behavioral Health, and I have been browsing at the guidebook as you were talking, and I would just say, just from the brief time I've looked at it, it's very general and broad, and not so much necessarily geared towards behavioral health. So in that sense, I suppose that is even better and can reach more people. So
Yeah. Yeah.
good
I
job,
mean, that
ladies.
was really our hope with it. Um, as Jenny pointed out, yes, we absolutely have written it under the umbrella of SAMHSA and our ATTC work. But also, we just want more people to have access to trauma-informed information on supporting their staff, which benefits our communities, I think, benefits the people that we serve, wherever we are, whatever kind of work we're doing. If we're in some sort of human service, we are interacting with people that have experienced trauma and are experiencing stress every single day. And that's hard. It's hard work. And it's important work. And we want to keep people well in that. I believe we have a responsibility to each other to ensure that that we do have good health and that we can navigate tough stuff, because the tough stuff's not going to end. We're going to keep being confronted with that. But if we can do that in a way that is supportive of one another, that's helpful, that's healthy, maybe we can get through it and be okay, right? Jason's got a question in the chat. Thank you. He says, I love the guidebook. It's so timely and relevant. As organizations participate in the intensive TA for TIC organizational change, will the guidebook be integrated into that TA process? Yes, we really hope so. Though we customize all of our TA projects. So a lot of that will be part of those initial discussions that we have with organizations that we engage with their TA requests around. So just kind of, I think my team would probably agree with me that we infuse all of these things into like everything that we do, or at least we try, because we really do believe in it. It's a foundational piece of being trauma informed, I think, to support workplace well-being. So yes. Good question. Other questions or comments? Well, I'm waiting to see if anybody else has anything. I do want to put a quick plug in also for our podcast. We have a podcast. You can find this podcast on Spotify. It's called Trauma Informed Caring. And we are currently in the process of moving the ones that are trauma informed caring over to its own platform. I don't think we've quite gotten there yet. The most recent season is there. You can access all of the episodes at this link, attcnetwork.org/podcast. That ought to bring up the entire Essential Conversations podcast series, which has some other, there have been a few other podcasts. It's like a family of podcasts, if you will, the Essential Conversations. So trauma-informed caring is a pretty big chunk of it because we are really ambitious about getting that out. I am totally biased because I'm one of the hosts, along with Roxanne, who's also on our call here. But I think there's some of the best podcast episodes ever. We've interviewed some really incredible people doing awesome things. Um, I just really enjoy hearing how people are, um, actualizing the ideas around trauma-informed care. How are they putting that into practice in their organizations, in their personal lives, in their work lives? So there's lots of stuff to explore there. There's a whole season on trauma-informed caring in leadership. Our most recent season was trauma-informed caring in unexpected places. I think we also have a season where we talked about well-being and resilience in particular. So a couple of you on this call have been guests on that, I think. So grateful. And then before you leave today, I also want to encourage you to complete the survey about this event today, about this launch for the Workplace Wellbeing Guidebook. You can get to it from the QR code or the link on the screen. I'm going to put the link in the chat also. It really helps us if you fill out that survey, because it helps ensure that we continue to receive grant funding, for instance. Also helps us track our impact when we go to do our reports on all of that stuff. Those of you who've had federal funds, you understand the need for tracking and documentation. So we really do value your input to that. It's a very short survey, like 2 minutes. All right. Anybody have questions or comments? I hope you get into that guidebook. If you do have questions along the way, you can absolutely reach out to us at the CTII. You can email me directly. I can put my email in the chat if that's helpful. We also have just a general email for our department. That's often the best way to get a hold of us. Goes to everybody. All right. Thank you. Thank you. Yes, well, if there aren't any other questions, I won't hold you unnecessarily, but I really appreciate you all being here today. Hope that you got something out of this, that you have a little better understanding of what's in that guidebook and how you might be able to use it. Like I said before, start slow, start at the beginning, but don't feel like you have to go step by step through it. And we're here to help along the way. So do feel free to reach out if we could be of further assistance to you. All right, I'll linger here for a little bit in case anybody does have any further questions, but thanks so much for being here. I appreciate you all. Have a good rest of the day.